At Centennial College, we train paramedic students for the realities of the job, not just the theory. That's why it was important for our program to integrate the SIMRIG ambulance trainer into our learning environment. Having a full-scale ambulance within the classroom allows students to train in a space that closely mirrors the confined environment and workflow of a real ambulance. This ensures students to learn to think, move, communicate, and treat patients the way they will on the job. Inside the SIMRIG, students practice in a realistic patient compartment equipped with key ambulance features, including a functioning simulated oxygen and suction, as well as the supplies and equipment they will use every day as practicing paramedics. This hands-on exposure builds familiarity, efficiency, and confidence, while reinforcing safe and effective patient care. Learning inside the SIMRIG also extends beyond the students directly involved in the scenario. Through direct visualization into the ambulance and the use of live video feeds from within the patient compartment, other students are able to observe real-time patient care, teamwork, communication, and decision-making. This allows the entire class to learn from each scenario, not just those inside the rig. And it's not just what happens in the moment. Recorded video from the SIMRIG is used for structured debriefing and review, allowing instructors and students to revisit actual performance. This helps learners clearly see what went well, identify areas for improvement, and connect their actions to patient outcomes. The SIMRIG allows students to practice the entire call, including the real challenges of working in tight spaces, managing equipment placement, coordinating with partners, and making decisions under realistic constraints. This prepares learners to develop competence and confidence before their first interaction with real patients. The SIMRIG fills a critical gap that has historically existed in paramedic education. In the past, students often had to imagine or pretend to be inside an ambulance, limiting realism and decision-making. With a full-scale ambulance trainer, students can now practice stretcher loading and unloading, patient positioning, equipment access, seatbelt use, and partner communication, all within the physical constraints of an actual ambulance environment. These experiences directly enhance situational awareness, logistics, teamwork, and clinical decision-making. The result is simple: better prepared graduates with stronger clinical judgment, smoother team performance, and safer patient care habits that will have a positive impact on members of our community when they step into the workforce.